Jada Glover, and this is my husband, Dr. Jeff Glover.
Hey.
And we're with gloverhealth.com, and we teach people how to naturally heal their bodies and relieve pain without medication. And today we're going to talk about a subject that unfortunately a lot of people suffer with, but we're going to go over the basics and talk about neuropathy. So what causes it?
What causes neuropathy? Well, basically, we'll start with what is neuropathy. Okay, neuropathy, when you break the word down, neuro means nerve, opathy means some type of dysfunction. So that means the nerve is not functioning like it should. Okay, well, what is a nerve? Now, you have your brain and your spinal cord together that form your central nervous system. And off of your spinal cord, you have these little filaments called nerves. And they send signals from the spinal cord to wherever these nerves go. They could go to your hands, to your feet, or to different organs, okay? So if those nerves aren't sending the signals that they're supposed to, then that's called neuropathy. So there's several different causes of neuropathy, and we'll just, to simplify things, we'll talk about peripheral neuropathy. That's the big thing that seems to be hitting a lot of the population nowadays. And what causes it, mainly, there's basically three main causes which we'll go over. One is diabetes. Diabetes is a main cause of peripheral neuropathy nowadays. The reason why is there's a problem in diabetes with glucose metabolism. Now with diabetes, you're slow to heal anyway. Now part of the reason you're slow to heal is of that problem with glucose metabolism. Glucose meaning sugar. So what happens is you have these sugar or glucose molecules that go over into the bloodstream, and your bloodstream, as you get to the distal extremities of your fingertips and your toes, those blood vessels get smaller and smaller and smaller, and they can't carry all the oxygen that they need to, which is what our body needs to heal itself and thrive. So that's what causes basically the neuropathy whenever you have diabetes. Now, the second main cause of neuropathy would be some kind of compressed nerve. So say a bulge disc in your back, a herniated disc in your back, that could pinch the nerve and cause the neuropathy symptoms in your feet. Now, the second thing, or the third main cause, is post-chemo or post-radiation. Now, whenever someone goes through those types of treatment, they kill the bad stuff, but they also damage some of the nerves too. Now, with post-chemo, post-radiation patients, those are the hardest ones to treat.
So it is treatable though, that's the good news, right?
Yes, it's treatable. Now, a lot of times pharmaceutical-wise, one of the main options is gabapentin. So we try to not make people have to take that and give them other solutions. Now, depending on what's causing the neuropathy, we'll do different things. Like say if someone comes into the clinic, what we would start out doing is do an exam, see how bad the neuropathy is. We have a scoring type system that we use. And once we've realized what's causing it, we can see, okay, are these people going to need decompression? Are they going to need laser therapy? Are they going to need nutritional supplementation? Are they going to need adjustments? Are they going to need vibration therapy? Are they going to need home type exercises or therapies? So there's a lot of different things that go into it, but it is very treatable. And in the office, we get great results with it. Some of the neuropathy symptoms that people will present with, they'll have, say, numbness, burning, tingling in their feet or their hands. Sometimes people will say that it feels like their shoes are too tight, feels like their feet are choking, or they'll wear shoes that are two sizes too big just to kind of make room for it. People will kind of catch their foot on something, they'll start bleeding and not even feel it. Those are classic signs of neuropathy.
Okay, so we're going to be doing a blog post on this, so make sure you sign up at gloverhealth.com, and we'll be talking about this a little bit more there, and that'll sign you up for our email list so that you can get that as soon as it comes out. So that's it for tonight. Thank you, everyone.
Yep. Make sure you click on your notifications whenever we go live so you can see whenever we do that. We'll see you guys.
Thank you.